Hello, everyone. Thank you so much for joining us today for this edition of Talking Kids Health. I'm Beatrice Canals. Joining me today is Dr. Reshma Naidoo. She is a pediatric neuropsychologist, a neurorehabilitation specialist at the Brain Institute, and PSA Director of Cognitive Neuroscience here at Nicklaus Children's Hospital. Thank you so much for joining us, Doctor.
Thank you. It's my pleasure. Always glad to talk to you about our children and their care.
Excellent. Today we're talking in particular something very important. Believe it or not, back to school is right around the corner. We're just, for some parents, less than a week away. And it's very important, as we always know, to prepare our kids as best we can for that first day of school and really for the entire school year. Right now, we're going to be talking in particular about some very special children with learning disabilities and specialized needs, and the way that you and your team are able to help parents prepare these kids for back to school. In particular, I understand that you work very closely with parents in what is known as an individualized education plan, or an IEP. What is that, and who's a candidate for it?
An individualized education plan is for any child that has one of the 13 learning disabilities. That would be reading, writing, math, emotional difficulties, anxiety, depression. And then we also have a whole group of children who don't quite meet needs under an IEP. These are the children with special needs. Any person with a physical disability, any child with a physical disability qualifies for a 504 plan. That would be all of the patients we see that have epilepsy, any medical ailment, epilepsy, brain tumors, any sort of trauma, and they need additional accommodations at school. That's when you'd get an IEP plan.
So when you mention the school, you work closely, and your team does as well, with the school, not just the parents in preparing these children and doing what they can to get them the help they need, but the schools in particular in implementing these plans, individualized plans for each child. How so? How does that relationship work?
When we work with schools, there's two capacities we work at. One, as the child's advocate and helping the parents prepare their child and telling them exactly what's going on and how to best help accommodate them. And then at the parents' request, the parents have to invite us along. And we come in as their guest and represent the interests of the child. And we work, since we all work with the same child, we work very collaboratively with the team and try to see what the school team can do and reach us and work together to provide the needs of the child.
I have to think that what is extremely beneficial in addition to all the help that you give is that, as you mentioned, you really do get to know the child and what their specific needs are.
Absolutely. I think we know the child as well as anybody does because we assess them over several days. And these are long sessions. Part of the process of helping a child get back to school is putting them to the rigorous school-like atmosphere where we sit down for about 3 hours at a time doing various tests. Some of them are academic pen and paper type of tasks, but a lot of it's got to do with thinking skills, reasoning, logic, planning, and trying to see how well the child can function. But during the process, what we're really trying to figure out is not just where the weaknesses are, but what if we make changes? How does this work? So during that process, what we're trying to see is how can we best equip this child for success and take what we have and make the very best of that child and help improve the areas that are an area of deficit. So when we're taking the child back to school, that's what our focus is. Not so much on Johnny cannot see things on the right anymore. It's more like Johnny uses his left eye. So when you're doing the things, place them on the left so he can actually focus on that and not miss Sally walking down the right.
Something that sounds as simple as that, but it must make a huge difference for the child experiencing that.
We find it very useful. Parents appreciate our feedback because we have a different insight to the child, and we're able to speak both the language of the parent and the school system because we understand both.
And for the parents to know they're not alone.
Absolutely.
In this journey and in helping their children. When it comes to, you mentioned planning for the child and the parents' participation, which is crucial, I have no doubt.
Absolutely.
Number one, their participation. What advice would you give to parents, not just for the beginning of school, which must be scary for everyone, regardless, correct? It's that anxiety of what to expect and how best to help your child, but really throughout the school year, what can they do to help their children?
I'd start with any child that's going back to school. It doesn't matter if you're going back after a brief illness, a prolonged absence, or right after summer, because that is the most anxiety-provoking period. You're going back to face a whole lot of unknowns. all parents are extremely anxious about helping their child get back to school. And I think we have to learn to conquer that first.
Yep.
If you as a parent can convince yourself that your child's going to be okay, and you trust the people you're going to entrust your child with, that is part of the journey. So in order for you to gain that confidence as a parent, you have to meet the teachers and meet the school, visit the environment and get to know everybody else, and then bring them in and draw them into the child's caregiving team. And that's where you take your child back to school, introduce your child to the setting, and acclimate your child to the environment. And once that happens, you're always going to go back and meet with the teachers or whomever's working with your child, so you get constant feedback on what's happening, and you also realize where the areas are that you can step in a little bit more and provide support.
How much is the participation that you and your team have when it comes to the school? Because you mentioned you do actually physically go to the school.
Yes, we do.
You can explain that to us.
So if parents invite us, and it always has to be a parent inviting us to go to the school, it has to be, the school has to approve because we're going to be guests. We participate in the IEP process where the entire team sits down. So the IEP process would have a special education teacher, general education teacher, the parents who are essential component of any of these meetings, somebody who's evaluated the child within the school setting. So that could be an educational diagnostician or a school psychologist, whomever's serving in that capacity, as well as someone in a position of authority who's going to grant these services. So someone has to be saying, it's okay, I accede to what's being given. And at that point, we provide the most profound voice at this meeting. The teachers know that the child needs something. The school knows that the child needs something, and the parents do as well. But we articulate that the best because we know exactly where the challenges are based on our assessment process. This is usually followed by teachers, at the request of parents, reach out to us, and the communication's open at that point. For some children, we actually go to school and observe them within the school environment to figure out where the problems are. For our brain tumor population and our cancer population, we have a good back to school program, a reintegration program. Specifically, if you've had a prolonged absence and your child's going back to school for the first time, we have an education program for the peers because the child's been missing for a while and they look different. So if you've had some of your hair removed, you've got an injury, those are difficult things for the other children to adjust to. So we go in and we provide them with some education, walk through a demonstration of what the specific needs are. So let's go back to Sally. If Sally cannot see on the right, then it's going to be very important for all of the peers to know, watch out for the right. You know, if you want to work with Sally and you're seeing Sally, remember, go on the left. And they create cues like this that the entire environment knows. You also would work with them to create a day. We usually call it the back to school day of whoever the child is, and have a whole packet of education, and that person becomes the star of the day. So they get to talk about their treatment, what's happening, why do they look the way they do, and in this way you normalize what would be otherwise a stigmatized experience.
I have to say, as a parent of a child who does not have any specialized needs, how wonderful the thought that you are also teaching the children, their peers, compassion, understanding, and making them a part of the process, because they really are such an important part, I have to imagine, of the process for these children with these specialized needs.
That has been one of the most gratifying parts of this process, which is why we keep on doing that. Because when you go to the school and you work with one class, I found that I never need to go back to that school again. Every child becomes an ambassador, and we also do education programs for the teachers. So we help them understand how to cope with the child that they're receiving with special needs, what are the medication requirements are, whether the child can participate in physical activities, what happens if someone's got chickenpox or the flu. When do I isolate, or when do I encourage this child to participate? Which is an extremely anxiety-provoking time for anyone who's not had a child that they've worked with before. And so it's been really good. And I think our the demands for us to turn up at school have started decreasing just because of our aggressive programs.
Because we've done such a good job.
Right. Oh, I think it's the community that does a great job.
That's wonderful to hear that they are reacting and stepping up
Oh,
in that
absolutely.
way. What advice do you have? You mentioned that's in school. So that's what goes on in the classroom and at the school, participating and taking into play the teacher and the peers and the student, of course. What happens at home? What advice do you have for parents who perhaps want to incorporate all of this when it comes to homework and the part of schoolwork that has to be done at home?
Unlike most people, this is where I really feel there needs to be some sort of a divide between the school day and the homework session. A child who's struggling, because going back to school after any major trauma, any major illness, you really have a lot of catching up to do. And you're overwhelmed when you're placed in this new environment. And one of the risks we stand is parents often want their child to catch up really quickly and to be going along with their peers. At the end of that day, it's really important for that child to decompress, to allow them time to be a child, something that you lose when you're ill. Because you spend so much of time being ill, now you're spending all this time trying to catch up with schoolwork, you miss all of the essential things that a child does, like lying down on your back and looking at the stars, if that's what you want to do. As far as possible, our suggestions are decrease the amount of actual tasks you need the child to complete. It's one of the things that we advocate for at school. So if you're doing math problems, instead of doing 20, that child would do 5. And then when you come home, if you're learning how to add, maybe that's what you do just as part of your day. You know, there are 3 of us going for dinner tonight. There's 1 plate. How many more plates do I need? And suddenly we're getting our children to do this as part of our
Without
process.
having to sit them down in the pressure of doing homework, you're still incorporating the lesson.
Absolutely. So one of the things I always use is taking children grocery shopping and giving them a certain amount of money and saying, well, if you can tell me how much this and that costs, you can have the change. But it also has to be
An incentive.
An incentive that you can afford. So don't give your child too much money, and also restrict the type of items that you buy.
Of course.
And you're
So
allowing
that
them
makes
to
sense.
buy.
But that's a wonderful way, I think, to get children to learn the lesson, but it doesn't feel as much about homework, and you get to also interact with them.
Oh, absolutely. As a parent, that was one of the strategies I used, and I have to say this because it was a very funny story. My little 4-year-old went up to, I gave him $10, and I said, well, if you can figure out how much those 2 things cost, and you can tell me if they're less than $10, you can have the change. And he went along and he stopped a man and goes like, excuse me, sir, how much does this and that equal to? And if I have $10, will I have change? And I caught him doing that out there in the hallway, and I thought it was funny.
It's funny you got someone else to do his homework, so to speak.
Mm-hmm.
Very
So
bright.
watch out for that too.
Yeah. Make sure they're the ones doing the work. But I don't know what to tell you. I think that's pretty smart on his part.
Oh,
He found someone to help him
got the
along,
change.
and he earned it. Any other advice you have for parents when it comes to testing? I know that testing is something else that unfortunately creates an incredible amount of stress for kids. Is there a way that they can better prepare their children for the day they have to have specific tests?
First of all, don't become anxious. Don't worry about it. Do what you normally do. Make sure that your child goes to bed early. Try and keep that day before a major test or any test as normal as possible. If your child has to study, which your child probably has to study, all of us do that before dinner. So once you get down to dinner time, that's your time to start decompressing and winding down. If you end up studying after dinner, that's when we find the anxiety levels go up.
That makes perfect sense. They've
So-
got that clock ticking. It's
Right.
running down to the wire. And also, they're probably anxious throughout dinner knowing that they still have that task. That
And
makes sense.
Break up anything that you need a child to learn, break it up over several days and have a lot of repetition. So that final day before a test is just a review, and it's not the big cram session.
So that takes some planning, parents, but it makes perfect sense. Do split it up in a way where you're slowly incorporating the information, going over it in pieces,
Correct.
parts, and then it's just a review in the end. So you're
Absolutely.
not leaving all of the material for last minute, especially for children who have specialized needs. Correct?
Oh, absolutely. And I think any child that has a specialized need, you need to review the content they've learned every day. So if they've learned something on Monday, review that content on Monday within your everyday activities, and then review whatever they've learned on Tuesday in addition to what they've learned on Monday. It's very important to keep on reviewing previously learned information because they would lose it, especially children that are having seizures, any type of seizure disorder or brain surgery.
They need to have that.
Multiple repetitions of the same information and things that you think your child knows. Don't assume that they're going to hold on to it. Go back and reteach and check.
I had a teacher whose saying was always, I don't know if it was hers originally, but it was repetition is the mother of learning, correct?
Absolutely.
So that makes perfect sense. Any other advice you have for parents who are getting ready and are anxious in some way, or when it comes to the special help that you do give here at Nicklaus Children's Hospital, who qualifies? If they're watching this now and they want to know, how can I go about knowing if I can achieve that help for my child before they go back to school? What can they do right now?
If you're talking about your child going back to school in fall, unfortunately, it's a little late. We're overwhelmed. We just do not have the capacity to do that. If you want to have your child have an evaluation, realistically, I'd say plan to have at least 3 to 4 months for us to be able to participate in the process, because we have to meet with you and find out what your concerns are, then get to know your child, get information from the school. This is a long process. It takes at least 6 weeks. In our best cases, we can turn those around in a week, but those are very unusual circumstances. And then once we've done that, we have to have a meeting with the school. And to be able to get that, that's usually a couple of weeks as well.
So be patient, but know that the help is out here if you need it, and all you have to do is reach out here to the wonderful team that is ready and willing to help. But again, that it will take time. So back to school for now for those parents, perhaps here they wouldn't be able to, but if they know, I'm assuming that their child perhaps is going to have surgery down the road, and they can look ahead and say, we want to best prepare our child for when they have to go back to school. Perhaps they can reach out to you.
Typically, any child that has surgery out here in the Brain Institute, they reach out to us, we reach out to them, and we follow you up in our surgery. So we, in our clinics, so we do know who you are and try to stay on top of that. If you need, my best advice for anyone going back to school right now is take this time, get to know your teachers, take your child to school before everyone's there, so they become familiar with where things are, they're not overwhelmed. There's nothing as difficult as finding your way to the restroom in a crowded hallway and you're afraid to ask someone. So if you actually know where these things are, it makes life a lot easier. And if you know where the library is, you're likely to use it rather than never knowing where it is and having to ask someone to get
That's
there.
wonderful. So parents, keep that in mind. If you have the time before your child goes back to school, contact the school and see if perhaps you can go in a day or two before classes start and walk through the area, especially if it's a new school for your child. I have to imagine the anxiety.
Even if it's an old school, your child, over the break, you do forget. And it's a long break. It's almost 3 months. So take some time. Any child with a special need, you should take them back to school a couple of days earlier. And most schools are very amenable to that.
Doctor, thank you so much for giving us so much information. Hopefully the parents who are watching us now received information they needed as well. But if you want more information on this, all you have to do is log on to nicklauschildrens.org/brain, and all of the information will be there. The doctor is kind enough. He will be sharing some resources with us as well that we will include on Facebook for you, so that you have all the information that you need. We hope that you join us again for the next Talking Kids Health here at Nicklaus Children's Hospital. I'm Beatrice Canals. Thank you so much for joining us. We'll see you next time.
Thank you. Bye-bye.
Thank you, doctor.
Thank you.
It's wonderful information for parents.